Welcome. Thank you for joining us. My name is Michaeline Friedenberg. I'm the president and CEO of Life Perspectives, coming to you today from our national headquarters in San Diego, California. For those of you who are new to Life Perspectives, let me start by briefly sharing our mission and the goal of this webinar series. Life Perspectives is the global expert in reproductive grief care, offering evidence-based grief care education and training for healthcare professionals and community leaders. We are at the forefront of creating and distributing impartial and impactful research to understand the way individuals process reproductive losses so that we can establish global standards for offering compassionate care. Our quarterly Research Reveals lecture series features in-depth discussions with the authors of some of the latest groundbreaking reproductive loss research. As you know, today's focus is on prolonged grief after pregnancy loss. So before we get started, I want to offer our condolences to anyone participating today who's experienced a reproductive loss. We're very sorry, and our thoughts are with you. I'd also like to share with you some resources that Life Perspectives offers to communicate to hurting individuals that they are not alone. MiscarriageHurts.com and AbortionChangesYou.com are anonymous interactive healing websites for men, women, family members, and friends impacted by miscarriage and abortion. Our toolkits for supporting those impacted are available at lifeperspectives.com. We also offer sympathy cards and remembrance gifts in our shop that's also on lifeperspectives.com. So I encourage you to take a look at these great resources, but of course, wait to do that until after the event. For now, I'd like to introduce the researchers of the study published in Frontiers in Psychology entitled Uncovering Prolonged Grief Reactions Subsequent to a Reproductive Loss, Implications for the Primary Care Provider. Coming here also from San Diego is the lead researcher and the lead author of this study, who also happens to be the Director of Healthcare Programs here at Life Perspectives. Catherine Grerholtz is an adult nurse practitioner and an advanced certified hospice and palliative care nurse. She has over 2 decades of experience working with adult patients in preventative medicine, weight management, hospice, antenatal distress counseling, and reproductive loss. She has presented on the topics of perinatal palliative care and reproductive grief care to healthcare professionals, both nationally and internationally. Joining us from Washington State is Dr. Nikki Berry. Nikki has 8 years of combined experience in geriatric, palliative, operating room, and trauma nursing, and is currently an assistant professor in the College of Arts and Sciences at St. Martin's University in Olympia, Washington. Dr. Berry teaches undergraduate courses on palliative and end-of-life care and is a Life Perspectives certified instructor. Dr. Berry's research in perinatal loss, grief, and bereavement focuses on decreasing the emotional trauma parents experience in the wake of a life-limiting diagnosis. And from Virginia, we have Rebecca Capuano. Rebecca serves as a client services manager at Blue Ridge Women's Center, a medical clinic in Roanoke, Virginia. She also coordinates the center's reproductive loss services and is a certified instructor with Life Perspectives. Rebecca has functioned in both direct and administrative roles in service to at-risk populations throughout her career, including developing a day treatment program in Wilmington, North Carolina. And then coming back to San Diego, we have Jillian Early. Jillian is a licensed clinical social worker in private practice. She is honored to provide support to individuals and families navigating their reproductive journeys. She has a master's in social work from Smith College in Northampton, Massachusetts, and has pursued extensive postgrad training in perinatal mental health and treatment of traumatic experiences. Jillian also provides reproductive grief care training to graduate students and licensed clinicians as a Life Perspectives certified instructor. So, wow, what an amazing group we have today. I want to welcome all of you and thank you so much for joining us. And just a quick note to participants, feel free to submit questions throughout the presentation in the Q&A box. We're going to answer as many as we can in the final 10 minutes of the session. So without further ado, though, let's jump right in. I'd like to start with posing a question to you, Jillian. Jillian, why did you think that this research topic is important?
Thanks, Michaeline. Thanks for the question. And again, thanks for having us all here. It's been so exciting to be a part of this research study, and really it's so needed. I'm a clinician. I've worked in perinatal mental health for the last 7 years. And when I got started working in perinatal mental health, I was working in a partial hospitalization program for women with pretty severe perinatal mood and anxiety symptoms, either in pregnancy or postpartum. And it was really astounding to see how many of them had experienced previous losses and who had never talked about it before, who hadn't had a chance to explore the impacts of that and how it was affecting them in their relationships with their children and spouses and people around them at that time. And so, you know, here we were in a setting where we're really asking about these things. And it just struck me that, you know, there are so many other settings where, you know, as clinicians, we're treating mental health conditions, but we aren't asking these questions. We don't know how they can be related to this kind of loss. And so I think what we know is practice follows research. So that's why it's so important to have this kind of research into how prolonged grief responses to reproductive loss can really impact the mental health conditions for quite some time. So that's really kind of from my clinician view, that's really an important reason why we're doing this today.
Great, thanks, Jillian. Yeah, and that makes a lot of sense. Catherine, I want to turn to you as the lead researcher and author of the study. How did you arrive at the research questions?
Thank you, Michaeline. And I just want to kind of expand, you know, I liked what Jillian said, and just to kind of expand on like what my thoughts actually mirror hers a little bit. So I previously worked as a hospice nurse practitioner assisting people in the last months of their life. And there were patients who acknowledged that an early pregnancy loss was still a source of existential distress that weighed on their heart. And it seemed to me hard to fathom that decades later, in a patient's last days, that they would still be grappling with grief related to a pregnancy loss. And so these experiences made me wonder about the length of time that reproductive grief can last. And also, because I want to honor those who give voice to those who are hurting I wanted to give voice to those who are hurting as a result of reproductive loss, as well as keep the educational content of our programs synchronous with real life experiences. I regularly read and reflect on the stories that are posted on our healing websites at Life Perspectives, abortionchangesyou.com and miscarriagehurts.com. And so when I ponder those narratives, I was really struck by the length of time that the authors had reported that elapsed between the date of when they experienced a pregnancy loss and the date in which they recounted their stories on the websites. And there was a common, I think there's a common misconception that reproductive grief resolves and that a person moves on fairly soon after the loss. I mean, I even had that thought myself. And, people think, well, maybe it'll be over in a few weeks or maybe a couple of months. But, this didn't really seem to be the case in so many of the stories that I was reading. Many of those who were telling their stories reported that they were perplexed by the length of the time that they were experiencing this grief, especially since societal norms would make them think that it should be otherwise. So I'm, just top of my head, I'm recalling one woman said, I'm 63 years old and I had an abortion when I was 15 years old. And all these years, I have never spoken about this to anyone. Her pain was almost palpable when she continued to tell all that she'd endured in 48 years. I noticed that sometimes the authors on the website narratives used exclamation points to suggest their astonishment about the prolonged length of their grief experience. Also, when reading the stories, I noticed that many described challenging mental health effects and relationship issues that they attributed to the loss. So things like suicidal ideation, alcohol and substance misuse, anorexia, visual and auditory hallucinations, recurring nightmares, and abusive situations and divorce. What I was reading in these stories, I wasn't seeing reflected in the literature. And, I know that there's very little research evaluating the mental health effects of early reproductive loss. And I really felt challenged reading these stories to make the complex and maladaptive grief responses and these prolonged times to really make it known. And so these are some of the reasons why I was led to this research questions.
Wow, and I can really relate to that. I mean, I too, Catherine, read the stories as they are coming in, and I'm so touched by the trust that people have in actually expressing it, and that they found a place to do it. But I've also wondered myself, and I'm so glad that yourself and the team here took it upon yourselves to actually really dive into those stories and to really get a better understanding of what it is that they were trying to communicate. So Nikki, can you, you have extensive experience in research, and I was hoping you could walk us through the research process.
Absolutely. That's such an important question too, to know how we came about the results that we found. So just to kind of summarize for those of you who are not familiar with researchers or maybe researchers yourselves, there are two main categories of research. So two approaches that you can go through. One is quantitative, and that is heavily numbered. There's a lot of statistical analysis, there are large sample sizes, and the data tends to be surveys and anything that you can put a number on. So that's quantitative. And then the other category is qualitative. Now that tends to have much smaller sample sizes, and rather than looking at survey results or statistical analyses, qualitative really looks at the lived experience of those that we are investigating or researching. So with reproductive loss, we would have a smaller sample size, and we would look more at what the participants are saying. So what are the women in these blog posts saying? And from that, we can generate more questions. So with a smaller sample size, you can't generalize it to this population like you would with a quantitative sample of 1,000 participants. But one thing that is very important in qualitative research, as Catherine mentioned, the literature is not reflecting the symptoms that these women are bringing forward. And so that begs the question, why isn't this reflected in scientific research if this is what people are experiencing? And that qualitative research comes in. That helps us look at those experiences so that we can start asking the right questions. So in this example specifically, we used a type of qualitative method called content summary. And what we did as a team, we looked at each different blog post from the women. There were over 140 of them that we read individually. And as we went through, we were remembering the research questions. We were looking at how long has it been since this event has occurred, and how long is it taking women to disclose their experience. We were also looking at the symptoms, adverse symptoms that they were talking about, so suicidality, substance misuse, symptoms of depression or anxiety. And we're seeing how often is coming up in these stories. And we did a little bit of a statistical analysis, just a simple descriptive statistics. And so that means counted how many times people would say, I experienced depression, or I started smoking, or I started using more alcohol, different types like that. And that helps us really to look at what we call frequencies and how often is this occurring, how many people is this occurring with, and by understanding that, that really helped us narrow down the questions for future research. If this is happening with this great a frequency, then why and what can we do about it? And so that's really the approach that we took, and we went through it as a team just to make sure that if we had one person, we run the risk of having a biased interpretation because there's not that hard numerical data like in quantitative research. So as a team, we went through and we analyzed everything and discussed it so that if we had someone saying, oh, I found this, but no one else did, we could go back to the data and say, oh, is this consistent with what the participants are saying? Or do we need to rethink what is? And that helps us get a more accurate picture of what these women are experiencing in their loss.
Well, thank you so much for walking us through that. It also sounds really time intensive. It sounds like each of you were taking those stories and analyzing them yourselves and then coming together. But how wonderful for those who, again, trusted us with their stories, that we would take the time to do that. So you talked about those and touched on those research questions. And I think now I think we can go and look at, okay, so what were the results of that? And I'm going to turn to you, Rebecca, again, to answer, to help us to see what you found in the first research question. But first, let me read that question. Again, this study was available. I'm sure some of our participants read it before they came on. Maybe others didn't have time to, but they can certainly go back and read through this themselves after this. So the first research question was, what is the length of time that women disclose regarding the date a miscarriage or abortion occurred, and when they sought a venue to share their stories on a reproductive bereavement website blog post? So that span of time between, right, the event and when they actually sought out to disclose this. And so would you share with us the results of that question, Rebecca?
Absolutely. Thanks, Michaeline. So it's really interesting because one of the things that the research found, that we found through this research, is that women did tend to wait for a period of time after a loss before sharing the story of that loss through a blog or through a post on this website. And for me, what was really interesting about that is that the research from the sample supports what we see here at Blue Ridge Women's Center. As a pregnancy medical clinic, I work a lot with clients who've experienced reproductive loss. And what we do find, anecdotally, is just what this research showed for this particular sample. So it's always wonderful when you see research that is trending. You're seeing that it's kind of explaining and trending along with what you're anecdotally experiencing. It really, almost 40% of the women in the sample indicated that their loss occurred at least a year prior to that. So, I mean, that's a lot. And when the loss was at least a year prior, nearly half of the women waited more than 4 years to share their story. One woman actually that posted, one of the things that she said was, 11 years later, I am still having issues. Not all the time, but coming up to the anniversary of the miscarriage. April 1st is not funny at all. That's the day my life changed forever. And the experience she wrote about there is, I will say, something that I see and hear regularly from clients who come to Blue Ridge Women's Center. This sense of, this happened a long time ago, but I have not even talked about it, or I haven't shared about it. I haven't processed through it. In many cases, I didn't even realize that it was an issue until recently. Particularly interesting was the length of time that we found that passed between the loss and someone sharing that story or posting about it. And for those who experienced abortion, that ranged 47 years, 47 years, with a mean of 9 years. So for miscarriage, it was a little bit less. For miscarriage, it ranged 10 years, with a mean of 3.3 years. So if you think about that, I mean, that is a long time. If a woman's had an abortion and she waits 9 years before she shares and can express that, that is just almost a decade of time that she is living with the difficult feelings that she's experiencing from this experience. So it's very important to understand this time frame. And I will say also that in our work here at Blue Ridge Women's Center, because we do offer a lot of reproductive loss support for all different types of reproductive loss, and we see similarly that those who've experienced a miscarriage, although they do tend to wait before seeking help and healing and those kinds of things, they don't tend to wait as long in sharing their stories as those who have experienced abortion. We have had clients before in their 70s who have come to seek out reproductive loss support after an abortion for something that happened more than 40 years before. So that range, that 47-year range that this research found, is something that we experience in real time here with our clients on a daily basis. And that is profoundly sad, but also profoundly exciting that this research is helping us to get a better understanding, to inform our practice of how we can really impact people's lives, how we can open up the conversation so that they can begin the healing process earlier and not have to wait 9 or 47 years to be able to do that.
Right. Yeah. Thank you, Rebecca. And it is heartbreaking thinking of people waiting that long. I was also thinking back to Nikki when you were describing just kind of the process and the differences of research. So, although certainly we know we can't generalize from this, it is interesting when we do start to see maybe some correlation, but also those research questions. So you're saying this, when you were just talking, I was thinking, oh my goodness, this poses a lot of different research questions that hopefully perhaps some of you or all of you will take some of those on in time to help us to better understand. So let's look at the findings then for the second research question. And I'm going to turn to you, Jillian, but let me read that really quickly. So the second research question is, what, if any, maladaptive responses to reproductive grief were disclosed in the narratives commensurable with the time elapsed?
Thanks, Michaeline. So in the research, what we found was a number of maladaptive responses to grief were indicated in the narratives written, including, and I'm going to read the list here, there was intimate partner relationship strain, divorce, breakup, distress in parental relationships, impacts on relationships with subsequent children, post-traumatic stress disorder, depression, suicidal ideation, anxiety, both with and without panic disorder, reports of substance misuse, anorexia, and occupational dysfunction. So getting in the way of things like work and school. Each of these concerns were identified in the samples from both platforms, aside from suicidal ideation and anorexia, which were only reported on the in the samples that we had from the abortionchangesyou.com platform. And so there's a slight difference there, but overall we saw very similar responses to prolonged grief, and actually between the group that had reported their narratives less than 12 months since their loss, and then more than 12, there was a more than doubling of reported maladaptive responses to their as a result of their grief. And so the prolonged grief group had more than double the reports of these prolonged maladaptive behaviors or responses, which in this sample is really interesting, and again begs further research questions.
Right.
There are a couple other highlights for me. Was 1 in 4 of the writers reported relationship strain. So that's 25% of the reports that we had here reported some impact on relationship. There was one quote that really stuck with me of a woman writing that said, in with regard to her relationship after miscarriage, we're still together. I thought that this time was going to be my chance to heal, but he never shared the hurt with me, and still to this day doesn't. I literally cry alone almost every day a year later. And so really just speaking to that growing gap and distance that can come when we don't have attuned support for people experiencing reproductive loss. Others mentioned other kind of negative relationship impacts, including breakups and relationships ending. And then to me, with my background in trauma, what really stood out to me too was that 1 in 8 of the narratives analyzed reported PTSD symptoms or diagnosis, which is really high. And for me, that was really shocking. And 1 in 3 of those losses had occurred more than 10 years prior. And so we're talking long length of time with really intensive symptoms that are impacting all kinds of areas of life, avoidance of triggers, coping with substance misuse, withdrawing from social supports. And so just that impact was really impactful for me, seeing that measured that way.
Right. Wow. Thank you. And I'm just thinking as each of you shared some of these stories, and I know for me that really hit me reading this again, just in the narratives, and thinking too that, my heart is always like, it's not that we can erase or take away the pain, right? That's not the point of it, but to know that we could come alongside and perhaps do that in a way to support people earlier. So Catherine, kind of coming back to you on this. So as Rebecca and Jillian are sharing these findings, what do you think that these findings mean?
I'm so glad that you asked, Michaeline. Reproductive losses specifically related to miscarriage and abortion nearly equate to 2 million losses per year in the United States alone. So the impact of grief related to these losses leaves a huge imprint on each person and on our society in the well-being that they're experiencing. But we don't talk about it, and you won't find, again, you're not going to find the research about it. So although that these stories were drawn from a 6-month period of blog postings, I think this story really demonstrated the hurtful toll that prolonged grief reactions have on the well-being of so many. And I know that early pregnancy loss has been associated with a grief trajectory that isn't acknowledged in our culture and society. For healthcare providers, I believe that the findings of this study are relevant because prior research findings have found that many research professionals report not feeling equipped with empathetic communicative modalities or the practical applications that can help them to promote a more healing grief trajectory. Also, in polls that I have administered, many admitted that they don't say anything because they're afraid that what they say might worsen the anguish of those who are hurting or re-traumatize someone who's grieving. So, nothing is said at all for many people, and it just remains uncovered and unaddressed. Now, on the flip side, when listening to those who are grappling with miscarriage or abortion, I so often hear that the worst part of that experience is the painful silence and isolation that they encounter after the loss. So you can see why there's this disconnection. Healthcare has become so increasingly high tech, and relationships in our society have really been changed a lot, just even in the last 10, 20 years with the advent of digital communication. Empathetic communication and compassionate practical applications surrounding pregnancy loss and grief are just so paramount to enhancing the educational curriculum and so needed in these days. I find that the findings of this study really highlight the practice gaps in the delivery of healing grief care. And one last point, when I reach out to healthcare organizations inquiring about the provision of reproductive grief care and really to assess what their educational needs are, I find that the topic is often immediately dismissed because perhaps they've provided maybe bereavement care course or training to the nurses on the labor and delivery unit or maternity ward. But when you're looking at the length of time and the extent of these biopsychosocial impact that was uncovered in this research study, it really highlights why the need for reproductive grief care spans across the entire healthcare continuum, from primary care all the way to hospice care. And it shouldn't just be limited to one kind of unit or floor like the maternity ward. So these are just some of the reasons that, yeah, I think this study is really important. Thank you.
Yeah, well, it is. I mean, you stated that really beautifully. And it's interesting how you like described this, it's like this circle of silence, so I'm silent because maybe I've had a loss and I'm afraid to tell others because I don't know how they'll respond, or I think there's something wrong with me because I don't know of other people who are reacting this way. But then the healthcare providers remain silent, actually what you were describing, more out of their care and concern and compassion, because they're so afraid that they might actually make it worse for someone, but then the silence continues,
Right.
which is what you were observing here. So Nikki, I think that leads right into just kind of a natural question that I know was brought up in the study, and that was this recommendation to have a reproductive screening tool, grief screening tool. And so I'm wondering, why you think that a tool like that is needed.
Thank you, Michaeline. That's an important question. One thing that tools do is they tell us that whatever it is we're measuring is important enough to measure. So that highlights the significance of whatever concept it is we're looking at, like this reproductive grief. And it also is needed because there is already this loss screening occurring. How many miscarriages have you had? How many terminations have you had? How many pregnancy losses? That's already being recorded in the healthcare record, but it's not being addressed. Subsequent grief is not being addressed. So by having this tool, not only does it say this is important enough to take note of, it actually does take note of it, and it provides the healthcare professionals with a segue into assessing grief response following those reproductive losses. Because reproductive loss, it's so unique to everybody, and people don't grieve in the same way. They don't grieve in the same timeline, and it's important to have some way to open that conversation and give those parents permission to say, yes, I'm struggling. Yes, I'm grieving. Yes, I'm having a hard time. I need help. Because they are not bringing the questions to us as healthcare professionals. It's our responsibility to be asking those questions. And this tool would really equip healthcare professionals with what they need to really open that conversation. Another thing that's important about a grief screening tool in this scenario would be it would provide the data that we need to see how prevalent are these responses, how frequently is it happening, and at what time frames is it happening. So we can get that data, but we can also allocate necessary resources to those who really need them. If we're just asking how many miscarriages or terminations have you had, we record them and move on. We can't give them the bereavement resources that they may need to help them with those suicidal thoughts or to help them with that increased alcohol intake. Another important thing is that it really, by identifying these earlier on, or even identifying them, I mean, some people, maybe it has been 30, 40 years since their loss has occurred and they are still struggling, but you have to identify it before you can start treating it. And so in having this tool to help identify these responses, we can start treating that and hopefully decrease the intensity and as well as the prevalence of these adverse outcomes.
Great. Thank you. Thank you for explaining that to us. And I liked it as well that you acknowledged that everybody's response is really unique. And so certainly I know that there is not an attempt here to say that everybody is going to be this distressed, or maybe even that they would be distressed or feel grief. But you're looking at those who are having some difficulties. So I really appreciate that you're pointing that out as well, the uniqueness. So I'm thinking right now, I would imagine that, I mean, I'm certainly thinking this, so I would imagine our people who are participating today are as well, is kind of getting down to that really practical, like, what can I do? What can I do to aid somebody who may be struggling after a miscarriage or after an abortion? And I'm wondering, Rebecca, if you could help us with that.
Absolutely. So one of the most important things that we can do for somebody who's experienced a loss is to be a safe place for them. And one of the best ways we show how to do that is by allowing them to express their story, to feel whatever they feel, not to try to cut off that pain, but to, for lack of a better term, to be able to sit in it with them. To be able to allow them to express what they're feeling, because of course this is part of some of the training that we do. This is such a disenfranchised type of grief where our culture just doesn't give people the opportunities to talk about it and to share about it. And often our culture can give people the message, this loss doesn't really matter. It's no big deal. You can have another one, that kind of thing. And that can make it really, really difficult for people to find healing. So simply acknowledging the reality of their pain is just foundational for helping people to begin the healing process. So doing things like simply saying, I'm so sorry. Or even if you're not sure what to say that, to say, I just want you to know, I don't even know what to say, but I'm here. Or just letting somebody know that they're not alone. Having that empathy and that support, knowing that they're okay with whatever they're experiencing. That a lot of times when we go through a loss, we can feel like we're the only ones experiencing this because the culture often doesn't give us a forum to validate our experience. So letting people know, it's okay that you cry. It's okay if you feel angry. It's okay if you're struggling in these ways. And just letting people know a little bit about the grief process and just sharing with them, there's no timeline. Do whatever you need to do to be able to get to a healthy place. And then, of course, I would always add that giving resources, helping people, pointing them toward healing resources like the Life Perspectives websites are critical for that. For those of you watching, Life Perspectives offers incredible trainings that answer the question Michaeline just asked me about what to do. We have all whole trainings on that will specifically walk you through practical ways that you can personally, in your personal relationships, in your professional relationships, in your organizations, that you can be an excellent support for those who have experienced reproductive loss. So I really encourage you to check out the website and check out those training options, because some of them are in person and virtual, lots of different forums as well as webinars. But there are also healing resources that Life Perspectives offers that can be like download kind of things. And we use a lot of Life Perspective resources here with our clients to help them begin that journey of healing. But again, probably the most important piece is you being there and letting them know, I care. I know this matters and I care. And you're not alone.
Yeah. Thank you, Rebecca. And I imagine that there's others who are participating who probably know of local resources that are in their area. And it's always good, as you said, to know and have those at your fingertips so that you can share them with others. But that important piece of we can get really complicated about it, but what you were describing was it's not easy, because I think it's difficult to be with someone when they're in their pain, but it's kind of simple. Like you just said, to be there, to be present. And I guess going back to what Catherine was describing, it's breaking that silence, which seems to be why people were even coming to the website to share their stories to begin with. So I have one more question for the panelists here, and then we're going to turn to the questions of those who are participating. And I'm seeing that people are putting those in the Q&A box. Continue to do that, and we'll get to as many of those as we're able to after I pose this last question here. Catherine, I'm going to start with you, but then kind of let this open up to any of those here who worked on the study, and that is, what are your recommendations for future studies?
I have lots of ideas for future studies. They just keep coming. But I would like to see more longitudinal and quantitative research using the reproductive grief screening tools. So different types of tools in maybe primary care settings, really want to study the extent and impact of reproductive grief. And like Nikki was explaining, we need to have those tools that could be easily administered and validated in different kinds of settings. I would also like to see more research on the impact in a variety of, the impact of using a variety of different practical applications and maybe specific effective communicative modalities. So, I mean, we hear so much from learners, like, can you give me something, exactly what I should say? I mean, every situation would be different, but just having some practice with some communication, some things to say when they are encountering this, I think would be really useful for those care providers who are just encountering it for the first time. So just that they would already have a few things that they already know and maybe have practiced to use those communication modalities, and just studying the effectiveness of those and the comfort of the learners, those care providers that are using them.
Fantastic. Were there any others that had some ideas on some research that you would be suggesting for future studies?
Yeah, Michaeline, actually, one that's come up for me fairly recently through a client. We had a client who was seeking some support, a male client actually, related to reproductive loss, related to parental alienation, or the idea that in a divorce situation or other kind of situations where one parent is trying to, there's a concerted effort to alienate the child from the other parent by denigrating them, saying bad things about them, that kind of stuff. And this particular client was seeking reproductive loss support specifically around that issue, because in this case, the child had not died, but he was not allowed to see the child or interact with the child. So he was still experiencing that loss. And that really brought up for me what a great area of research, because I started looking online at some of the things related to fatherhood and parental alienation. And there's not a lot of anything for support related to that kind of grief, which I think absolutely falls in that realm of reproductive loss. Even though it's not a death, it's still a loss.
Right.
So I'd love to see more research on that.
Yeah. Well, and certainly, I mean, in this particular sample, these were women who were sharing their stories. And so, I would imagine that everybody here on the panel would love to see more with men, to be hearing from their perspectives on this. Were there any other thoughts on this, or shall we go to the questions that our participants have posed?
I would like to say that I echo everything that Rebecca and Catherine have said. There are a great need for intervention studies specifically, and as well as expanding our understanding of the reproductive loss experience in different populations. So the majority of reproductive loss has been conducted in studies that are primarily Caucasian females who are middle to upper class. And so we need to expand that horizon of minority populations. Brief studies in men, and this fall I'll actually have an intervention study for men that I am going to be doing. So that is, there's a little bit done out there. So we need to expand on that. And another thing I would add is it's really necessary to frame this experience of reproductive loss in the framework of a trauma. Because we're finding, and research is finding, that reproductive loss can be very traumatic. And there are a lot of symptoms of post-traumatic stress in up to 44% of the women who experience reproductive loss. And so it's important as clinicians and as researchers to look at it through the lens of a trauma, because that influences the questions that we ask, influences the interventions that we are looking at, and as well as just how we frame our overall interactions and research projects. That's what I would have to add to that.
Right.
And
Great. Yeah.
I could just chime in on that too.
Of course, Jillian, of course, yes.
Right. If we're looking at it through the lens of trauma and we're looking at, best practices, right? I just would love to see that we know trauma is less likely to happen when people feel safe and supported as they're going through an experience. And so is that healthcare provider education? Is it environmental measures that we can take to help people feel that way? Is it calling in resources and supports for people and kind of helping lead them through that process of, hey, you need this, like, let's do this right now. And so really getting into those pieces of best practice and how we can prevent these long-term kind of maladaptive mental health sequelae, like that that's huge.
Great.
So.
Great, thank you. Well, I mean, all this is wonderful. And I think we have participants who are coming up with their own ideas as well. And also thinking of adoption, you know, looking at that as, you know, reproductive loss. So let's turn to the questions that we have right now. There's a lot of them and they look great. We'll get to as many as we can. I'm just going to throw this out so anybody on the panel here can answer them. So Jerry's asking, are there any resources for siblings? And she says in particular, like they were excited for the baby to come, right? And then there's a loss.
Yeah, I can take that one actually. There is a great nonprofit organization called Forever Footprint, and they focus on supporting siblings whose sibling has died to some form of reproductive loss. They put together little backpacks that have memorabilia and teddy bears and books and different things on including the sibling in the loss and acknowledging that they are grieving. And it also provides tools for parents in how to help their child deal with their grief and how to talk to their child about their sibling is no longer with them. Because Jerry, that's a great question. I've had participants in my study say, you know, my son was 2 years old. He didn't understand why his sister didn't get to come home with him, or my 5-year-old child didn't know why they couldn't bring their sibling home. And the kids do have traumas later on. One story that stood out to me was a participant saying her child, she had lost a pregnancy to anencephaly, and her living child knew that something was wrong with their sibling's head, but didn't really understand. And so when they went to kindergarten, one of their classmates had a birth defect that was obvious on the head, but it was not endangering them in any way. And this child just had a complete panic attack, and the parent had to come home because in this small child's mind, like that something wrong with the head meant that they were going to die. I just didn't understand. So obviously there needs to be more, but Forever Footprints does offer some great resources.
Wonderful.
I would also just add to that art therapy can be incredibly helpful. So on a personal level, with my own personal experience with loss, my young children at the time participated in art therapy, and it was very, very helpful for them in being able to understand some of those concepts that at like 4 years old, they have a hard time understanding.
Okay. Great, thank you. All of that is excellent, but I think agreed upon that there could definitely be more resources available for siblings. We have a couple participants who are actually asking a similar question, but I'm going to pose the one by Mary. She says, are you finding an increased research interest in infertility as a reproductive loss? And then she just was asking if we can recommend any research, and that may be something we have to post later, but there was definitely questions about infertility as reproductive loss. Not only research on it, but then also how do we, again, support others who are really struggling with this?
I can answer that one. So there was a few of the stories, and they were experiencing infertility was, you know, factoring in with their experience of reproductive loss, multiple miscarriages. And they were really they were struggling with that, and that was really contributing to their mental health and relationships, particularly with maybe previous children that they had and their spouse. So that is a very important question and very necessary to be, you know, we really need to study that in research. And I have been really looking for infertility research that studies the grief related to infertility, and there really is a real need for that. So we are looking for that, and we are looking to be supportive of that type of research and to come up with those questions. But I think something similar to this, doing some qualitative and, studies would be really wonderful to do as well. So yes, does anyone else have any more comments on that too?
One of the book series that has been found effective for some people who have had issues with infertility has been the Life Without Baby Kindle series. That book series has been helpful for some clients. So something for people to check out.
Any other thoughts in particular about how we might support someone who's struggling, as a result of infertility?
I mean, this is absolutely something that comes up clinically all the time. And so really, I think so many of the same concepts that Rebecca mentioned earlier and what we can do to help with pregnancy loss and early pregnancy loss apply in that situation too. One of the hardest things about infertility and the loss related to that is that there's always this glimmer of hope and maybe this time. And so it's an emotional roller coaster. And so really being mindful of that, helping support people through that and say, okay, in the lead up to your next transfer, what is that going to look like? Or as you're looking at exploring your options, how can I help you with that? And being really aware of, and it's okay if, you aren't interested in joining me for this, or can I ask if it's okay to follow up with you on this, or when would be a good time? And just really kind of having that awareness and that commitment to checking back in with people for that support.
Great. Thank you. Thank you so much, Jillian. And I know we could have, and we're hoping to have some future research reveals dedicated to infertility. So hopefully we can take that on a little bit more in depth. I want to go to this one, just a very, these are the things that we run into, very personal. So Jerry's sharing that her cousin lost her baby at 5 months, and Jerry apparently is the only person who really remembers that child with her, sends her flowers and necklaces, and remembers Isabel's birthday. And she's asking, how do I encourage relatives and friends of how it's important to ask about the baby, and rather than avoid saying it, than avoid saying such and such. So you kind of get the idea. What practical advice do you have?
I would say, first of all, thank you for remembering her baby. That is so meaningful to her, and that's really a great thing that you can do. And I know that that's hard on your part as well. One of the more important things really is to talk about it, to just continue to be courageous and to intentionally bring it up to other people. Maybe try to share with close friends and family to this person. I know that you may not understand what they're going through, but this is what they need. And other people likely are grieving, because perinatal loss, reproductive loss, doesn't just affect the one carrying the pregnancy. It's the partners and the parents and the families and aunts and uncles. So being the person to speak up and help break that silence, and maybe say, I'm going to send a card to her. Will you guys sign it? Or I'm bringing flowers over, or I want to take her on a walk, something like that. Just get that conversation going, I think, is the biggest thing that you can do.
I would just add to that also that if you can encourage them to look at the miscarriagehurts.com website and read some of those stories. The process of going through and coding these stories was actually very, very emotionally difficult in a lot of ways, because they're so personal and they're so heart-wrenching. But I think they do help people who may not be in tune with the feelings that people have after a loss. It can be very helpful in giving them more of a picture of what that experience is like.
Yes. Yeah, that's an excellent suggestion. And I've certainly heard that from others as well, that when they find themselves reading the stories, that this is a whole education. And then they begin to think about others in their lives who have had these types of losses and are thinking, oh my goodness, I haven't even checked in with them or acknowledged. So that's a great suggestion. I want to go on to another question, and that is from Mary. She's asking what can be done to educate doctors, medical clinicians, social service, and counseling professionals. How can this be taken more seriously?
Well, I have to speak up because that's my role at Life Perspectives, is to be educating and equipping healthcare professionals, physicians, nurses. We're hoping to be going into and doing more transformational reproductive grief training in whole units at hospitals. Particularly right now, we're working on some emergency rooms. So not just training the physicians and the nurses, but training the other helper staff. So, and working on the protocols, because I think getting everyone on board and everyone having the same training and having the same having similar training, but having the same ability to address that grief and to be sensitive to that grief, because it only takes a couple of people to disenfranchise that grief and turn that person off, say something that's not kind or ignore the fact that they've had a loss, to really make them feel that they don't have permission to grieve. So we want to give everyone in those organizations that ability to address the grief or to be sensitive when that comes up. And research, nurses and physicians love more research. So we want to support that in whatever way we can, because that is the way that professionals continue their learning and also continuing education. So getting courses that are, credentialed and supportive of practical applications and communicative modalities that can really help people to feel equipped and to feel that they can help that person when they encounter them. So again, we are offering those programs at Life Perspectives, but there is other organizations as well that offer maybe printed or research. So just whatever they can do to improve their knowledge of reproductive loss and how to equip themselves to be able to manage that when that patient comes in. So thanks for that question.
Thank you. Yeah, and we have, oh my gosh, we're running out of time here. I think I do want to make a comment that I've seen in the chat box, people expressing their shock that there isn't a reproductive grief screening tool. We shared that as well, but I do want to let the participants know that we actually are in some initial clinical trials with a tool, and hopefully we'll be coming back to you in the next 12 to 18 months with the results of those studies. And so hopefully we'll be able to change that. But if there's any of our participants who are interested in learning more, please reach out to us on that. And then let's just add with one, I just want to end with just one more on that personal level. And what I was seeing is that there's a couple different questions that are very similar, and what they're actually talking about is not the person themselves, but it's the grandparent. So, they have their daughter or their son had experienced or been part of experiencing a reproductive loss, and they themselves are grieving. And how can we help the grandparents? We have to do this in just like a minute, but if one of you could answer that question.
Sure. I mean, just
Thank you, Jillian.
Sure. Yeah, time pressure's on. But I think, really helping find that personal space to have their experience of the loss for the grandparent, and that they're getting support outside of the person who's going through the loss themselves. So their child who's experiencing the loss. And so figuring out that way to be a support to the person experiencing the loss, but also have a safe space to be processing their experience of the loss outside of that relationship. And that finding that balance can be tricky, but is definitely helpful.
Yeah.
And I would just add to that, one of the most important things you can do for a grandparent is just what you would do for an individual, which is to validate that loss for them. Validate how significant that is, that you recognize this is a loss for you as well as a grandparent. That's one of the best things you can do. And then just let them know you're not alone. I'm here for you any way I can help.
Great. Oh my gosh, our time went by so fast. Thank you again for doing this important research, for giving us your time today, and just for the work that you're doing.
Thank you so
It
much.
was an honor,
Thanks,
Michaeline.
Michaeline. Thanks for having us.
Wonderful. Thank you. And for all those who participated, I'm just thinking as we couldn't get to all your questions. I was seeing so much in chat, but to me, what was moving to me is just your obvious care and concern for others and your motivation to be able to better understand them and to be able to better bring them comfort and hope. So thank you so much. Just a couple announcements before we end here. Please fill out your evaluation to complete the class. Our team really values your feedback. For nurses and licensed clinicians, that evaluation is mandatory for you to get your continuing education hour. If you enjoyed this event and you would like to know more, I invite you to check out our other reproductive grief care courses, as well as our past research reveals, webinars, and we also have self-care classes. They're available at the same website that you signed up for this class. That's Life Perspectives learningsystem.com. Remember to check out those healing websites, miscarriagehurts.com, abortionchangesyou.com, our toolkits, our other great resources. You can access all of that on lifeperspectives.com. And then one more thing, I do want to encourage you to consider, as we say it, paying it forward. Help us to keep programs like this available at just a nominal fee, while also displaying your care and concern and compassion for men and women impacted by reproductive loss by purchasing one of these Life Perspectives Forget-Me-Not pins. Are $25. You can also get that on our store, lifeperspectives.com, but we'll put a link in your follow-up email. So just consider that. So once again, thank you so much for joining us. Keep your eye out for our next research reveals, which will be coming up later this year. And thank you so much.